Hello, and welcome to the overview and demonstration of the PA CareKit, Pennsylvania's new caregiver toolkit for families, friends, neighbors, and all kinds of caregivers.
The PA CareKit has been developed by the Pennsylvania Department of Aging as part of Aging Our Way PA, Pennsylvania's 10-year strategic plan for aging.
Aging Our Way PA is an initiative of Governor Josh Shapiro that was designed to meet the state's challenging demographics. In Pennsylvania, the number of older adults is growing as people live longer, healthier, and more diverse lives. However, we must transform our systems and infrastructure to support this older adult population as well as the caregivers who support them. We developed Aging Our Way PA thanks to the contribution of over 20,000 Pennsylvanians. The plan involves over 30 agencies, inside and out of the governor's jurisdiction, committed to the plan. The plan is structured around 5 priorities, 36 strategic approaches, and 163 tactics. The focus of this training video is tactic number 128, to develop a statewide caregiver toolkit for informal, unpaid caregivers.
The Caregiver Toolkit is now called PA CareKit. It's a collection of tools, information, and support. It's designed to support caregivers through key challenges in the caregiving journey. It's personal, practical, and ready for all kinds of caregivers. And we're making resources available both digitally and in print.
The PA CareKit was launched on May 28th of 2025 after 9 months of development. The development process included 4 key tasks. In Task 1, we were charged with developing a vision beyond the single statement of the tactic that was included in the plan. We also worked with experts and caregivers from the community to determine what their challenges were and what their expectations and needs were of the CareKit. This task also included research to examine other caregiver toolkits and determine how we wanted to design Pennsylvania's toolkit. In Task 2, we developed the content, the subjects and topics that are included in the CareKit. We also developed several tools and worksheets that could be used by caregivers and their support systems. And we edited the language to ensure there was full language accessibility. In Task 3, we worked with the Commonwealth Office of Digital Experience, or Code PA, to build out the platform on the pa.gov website that includes a personalized quiz as well as the organization and navigation design of the site. In Task 4, we continue to roll out the PA CareKit through organic, grassroots outreach and a formal marketing and media campaign. Before we continue, we would like to acknowledge all of the individuals and organizations that provided knowledge and expertise throughout the CareKit development process. Thank you.
As previously mentioned, we engaged community members to ensure that this toolkit was designed by and for caregivers. We launched a survey to inform the development of the toolkit that built on the 20,000 stakeholder comments from Aging Our Way PA. We received 243 responses, 88% of which identified as family or friend caregivers. Many of the themes identified helped us to understand more clearly what challenges caregivers were facing. Those themes include a low awareness of resources, a high level of stress, unrealistic expectations, and progressive challenges, navigation challenges, and many respondents provided additional considerations for support options to include in the toolkit. Caregivers have a low awareness of resources. The onset of caregiving is associated with a steep learning curve. Caregivers are often unaware of programs that support them and struggle to understand specific programs' benefits and entitlements. Effective communication and widespread awareness are essential to ensuring that caregivers know about and access resources available to them. Caregivers face a high level of stress. Caregiving is an emotionally complex journey that reshapes relationships and requires compassion for oneself and others. Caregiving is often too difficult for one person to handle, and building a supportive family network early in the caregiving journey is crucial to prevent burning out.
Caregivers have unrealistic expectations and face progressive challenges throughout their caregiving journey. Starting caregiving can feel overwhelming, but many seasoned caregivers told us that knowing where to find resources, tools, and support can make the journey more manageable. Caregivers feel unprepared for the decline of care recipients and the progression of the caregiver commitment. Caregivers face severe financial challenges, struggling with high care costs, limited financial support, and insufficient assistance. These financial strains can often be overwhelming and unexpected, and often most significantly affects middle-income families. Those who cannot afford to pay for care out of pocket and often do not qualify for assistance programs. Caregivers need proactive education and guidance to navigate the evolving role and unpredictable demands of caregiving, especially when they are new to the role. Caregivers face navigation challenges. A critical gap in caregiving is the lack of accessible and reliable resources, leaving caregivers overwhelmed and feeling unsupported. Caregivers face significant challenges due to the lack of communication coordination and information sharing within the healthcare and social care systems, meaning that hospital systems aren't really communicating with organizations that provide support in the community. Navigation challenges leave caregivers overwhelmed, financially strained, and emotionally isolated. Many caregivers expressed frustration with having to navigate online resources and deal with automated phone systems that lack human interaction.
Additionally, many caregivers provided considerations for support options that we have included in the design of the CareKit. We used all of this data in conversations with experts to come up with 6 key design elements. Visible and convenient. Caregivers are often pressed for time and may not have the resources or ability to search for information on multiple websites. Caregivers need to be able to find the information they need in a one-stop shop. Realistic and encouraging. Caregiving can be isolating, and many caregivers experience guilt, confusion, and stress. We designed the CareKit to describe caregiving in realistic terms and focus on language that encourages and empowers the caregiver to provide the best care that they can. Clear and practical. Caregivers often struggle with complicated jargon and unclear instructions. We designed the CareKit to ensure that the language was clear and translatable into their care practice. Up-to-date and accurate. The toolkit must be consistently updated to ensure that caregivers are provided with the most current information on services, costs, and care options, especially as things evolve and change over the coming years. Comprehensive and inclusive. The CareKit should address the diverse needs of different caregivers, acknowledging the unique challenges that come with various caregiving situations and stages. The PA CareKit is for everyone. Proactive and targeted. It's essential to support caregivers early in their caregiving journey, even before they identify themselves as caregivers. It's also important to ensure that people get support for their specific situation.
The PA CareKit is housed on the pa.gov website under the Department of Aging. On the website, people will be able to find the PA CareKit and be able to get connected to other state programs more readily. The website is also fully translatable. It will detect what language the operating system uses, or you can select the language that is appropriate. On the home page, you'll see PA CareKit, as well as some encouraging and supportive language. You'll also see 2 action buttons, the Take the Understanding Your Needs quiz, which we'll discuss later, and Apply for the Caregiver Support Program. The PA CareKit is a standalone product, but it is also a way to connect people to the existing system of programs that offer support for older adults, people with disabilities, and caregivers. The PA CareKit is designed to be an intervention for caregivers at the start of their journey that helps them get connected to the network of the aging and disability organizations in the community.
Moving down the page, you'll see a vertical navigation pane on the left side. This way, you can find the PA CareKit, subsections, or other pages on the Department of Aging website. You'll see another one of our key motifs, Thank you for stepping up to care, as we're trying to acknowledge and appreciate caregivers for the hard work that we rely on. All of the information on the PA CareKit is housed in 3 sections: First Steps, Caregiving Resources, and Self-Care Resources.
The First Step section is intended to answer the question, where do I get started? This section introduces the first 5 steps. This is a framework that is designed to help caregivers holistically and systematically analyze their entire caregiver situation. It is designed to provoke critical thinking and help caregivers define what they need. Step 1. Understanding your role. Before you begin, take time to reflect on your role as a caregiver. Step 2. Gather information. Being informed will empower you to make decisions with confidence. Step 3. Strengthen the support system. Caregiving is not a solo journey. Build a team to help. Step 4. Make a plan. Planning reduces stress and ensures no details are overlooked, especially in an emergency. Step 5. Take care of yourself. Caregiving is hard work, and your health and well-being matters. This framework is included throughout the CareKit. Click here to download the First 5 Steps Resource Guide.
This general Get Started guide is for all caregivers. It includes an introduction called Stepping Up to Care that is designed to outline expectations and milestones that caregivers may face in their caregiving journey. The general Get Started guide then goes through each step of the framework, asking thought-provoking questions and providing some instructions. Step 1 is designed to help caregivers understand where they fit in the caregiving situation with the care recipient. This step is about the type of care someone provides and how they feel about the situation. Step 2 is about gathering information to help informed research and ask the right questions. Step 3 is about involving family, friends, neighbors, and community organizations in supporting the care recipient and you, the caregiver. Step 4 is about thinking about caregiving more prospectively, about long-term care needs, day-to-day efficiency, preparing for emergencies, and preventing long-term challenges. Step 5 is about the caregiver taking care of themselves, how they are managing stress, eating, sleeping, and feeling balanced. We also encourage the caregiver to think about their successes, recognizing and rewarding themselves for the hard work they do to improve the quality of life of the care recipient. Every resource guide highlights 5 resources for caregivers: the local area agencies on aging, or AAAs, the adult day centers, senior community centers, the PA link, and the caregiver support program. It also highlights the helpful printables. These are worksheets and checklists that help caregivers with specific tasks and logistics of caregiving.
The next segment of the First Steps section is the many faces of caregiving. Although every caregiving journey is unique, there are some common caregiving situations. The many faces of caregiving highlights 9 common caregiving scenarios. The spousal caregiver. That's any partner or spouse providing care. The long-distance caregiver. Someone providing care from afar. The parent caregiver. An older adult providing care for an adult or grown child with a disability. The working caregiver. Someone balancing their career with their caregiving duties. The solo caregiver, someone providing care without a traditional family support system. The sandwich caregiver, someone that's providing care for children as well as a parent. The dementia caregiver, someone providing care for this specific condition, which has additional expectations and nuances. The youth caregiver, someone in their 20s, teens, or even younger who is providing care for an older adult or supporting their parent who is the primary caregiver. The grand family caregiver, an older adult providing care for a grandchild. Click on the link of the scenario that resonates most with you. Each scenario comes with its own tailored Get Started guide, which you can download by clicking the Action button. Each of the tailored Get Started guides introduces a vignette of a care recipient and a caregiver in this specific type of situation. This vignette highlights the challenges for the caregiver as well as the care recipient. Then, about halfway through, it highlights solutions and resources that the PA CareKit offers. These tailored Get Started guides follow the same framework and 5 steps and ask similar thought-provoking questions. However, these questions and instructions are adjusted based on the specific caregiving situation. The tailored Get Started guides also include the same resources for caregivers and helpful printables.
The Care Kit includes the general Get Started guide, tailored Get Started guides, as well as a customized Get Started guide that you can generate through the Understanding Your Needs quiz. You can access the quiz through several action buttons throughout the Care Kit. Understanding Your Needs quiz offers an even more personalized experience for caregivers. The quiz is essentially an assessment that helps caregivers identify what type of help they need in the most interactive way possible and understand the specific aspects of the care situation. The quiz follows the 5-step framework. On the first page, the questions ask about your role. How often do you provide care? Who are you caring for? How long have you been providing care? The next set of questions asks about the care you provide. What types of health and wellness care do you provide? Are there specific health conditions you're helping manage for the person you are caring for? The questions move on to ask about your support system. Do you receive regular help or support from others for caregiving? Do you feel comfortable asking others for help with caregiving? How has caregiving affected your relationships with others or yourself? The fourth page asks questions about long-term needs. What concerns do you have regarding long-term care for the person you are caring for? What about their housing situation? Are you concerned about transportation and mobility? Social participation? Do you have any financial or legal concerns? How will the person you are caring for be supported in a crisis? Do you know where to seek additional help with caregiving? Finally, questions ask about your health and well-being as a caregiver. How often do you feel overwhelmed as a caregiver? How is your physical well-being? How is your emotional and mental well-being?
Before you submit the quiz, you can review the questions and your answers. You may also edit any responses. When you are ready, you may fill in your name and email to receive your Get Started guide directly in your inbox. None of the information that you submit will be stored. Make sure that you enter the correct email address. Once you click Submit and have successfully submitted the request, you will be taken to the confirmation page and shortly receive your Get Started guide. You should receive a personalized email that looks like this, with the subject line, PA CareKit, Your Get Started Guide to Caregiving, from the Caregiver Toolkit resource account. The email will include some introduction and instructions, as well as the downloadable PDF. This is what your Get Started guide will look like. It will include a timestamp of your submission so you can keep track as your caregiving situation and needs change. The introduction to the guide is based on caregiver burden. The questions on the quiz also calculate a caregiver burden score. This score defines the level of burden that you are experiencing. For example, based on how you answered the questions in the demonstration, you are experiencing moderate levels of caregiver burden. Even moderate burden can feel overwhelming at times. Follow the first 5 steps below with information on your specific situation and needs.
The sections below follow the 5 steps, include an introduction, and includes bullets that correspond to how you answered questions on the quiz. For example, you selected that you are providing care for a parent. Becoming a caregiver can feel like stepping into the unknown. You may not even call yourself a caregiver, but feel that you owe it to your parents to help with their care. Caring for a parent can be complicated. It can feel like a reversal of your roles as parent and child, present physical challenges, and disrupt family dynamics. But it may also strengthen your family bonds and present moments of joy and happiness that change you forever. As you scroll down to the next steps, the bullets will include depersonalized links that direct you to resources on the PA CareKit based on your needs. For example, in the quiz, if you selected that you are helping provide pain management, dementia care, and end-of-life care, the link here will direct you back to a specific page on the CareKit to learn more about any or all these topics. Other links may direct you to subjects like chronic condition management for diabetes, Alzheimer's disease, or breathing problems. Even further, links may direct you to specific printable worksheets, communication tips, or local programs like senior community centers. All of this information and links are intended to help the caregiver identify what they need and absorb the information at their own pace. Your Get Started guide also includes resources for caregivers.
The First Steps section also includes other pages like the Caregiving Video Library and key caregiving terms and concepts. Click here to browse videos in the Caregiver Video Library. The Caregiver Video Library is a collection of videos that provide guidance for different caregiving tasks. Things like lifting and transferring, bathing and dressing, and dementia care. This information will help you feel more confident and prepared to provide care. The contents of this video library are made available with thanks to our partners, including AARP, UCLA Health, PA Home Care Association, and Family Caregiver Alliance.
The Key Caregiving Terms and Concepts page answers the question, what are the most important things I should know as a caregiver? Click here to browse the Caregiver Glossary. The Caregiver Glossary offers all the terms and acronyms and programs that you will need to know as a caregiver. You can also find information alphabetically. If you are looking for a clear definition on nursing homes, you can click N and find the information that you need. The next section of the PA CareKit is Caregiver Resources. This section is meant to address the question, how do I provide better care? It offers 12 topics and subjects with tips and resources for organizing your caregiver journey, accessing benefits, and supportive services.
First is financial planning and paying for care. This subsection is meant to address questions related to managing money for long-term needs, supports, and services. This includes advice on financial planning, entitlement programs, and basic information on Medicare, Medicaid, and other public benefits like PACE, options, and SNAP. Chronic condition management. This subsection will help caregivers learn about the most common chronic illnesses like Alzheimer's disease, diabetes, loneliness and depression, and others. Aging and community products and technology. This subsection provides information on different types of devices, modifications, and adaptations to assist with aging in the home. This page also identifies helpful apps and websites for more tech-savvy caregivers.
The page for Mature Driver Safety Tips directs you to a page on PennDOT's website that provides information on maintaining safe driving skills or having the conversation about when it may no longer be safe for someone to drive. Many pages like this one highlight additional resources and brochures for caregivers that want to learn more. Communication Tips provides information to make caregivers more effective communicators, not only with the person they are caring for, but also health providers and friends. This section also offers advice for specific situations, like avoiding family conflicts, asking for help, or if the person you are caring for has a specific condition like dementia or hearing impairments. Caregiving in a Crisis is designed to help you prepare for and handle 3 different crisis situations: hospitalizations, public emergencies, or when caregiving cannot continue.
Caring for Veterans provides information specific to caring for veterans, including accessing benefits. End-of-life care is designed to help you work through the different stages of care at the end of someone's life, including starting a conversation and making preparations, actually providing care, and steps to take after the care recipient dies. Legal support for caregivers can help caregivers navigate and understand topics, including finances, decision-making, guardianship, and other legal resources. You can also apply for the Older Pennsylvanians Legal Assistance Program.
Long-term services and support options. This subsection provides information on the different levels and settings of care that might be appropriate for the needs of the person that you are caring for throughout the care journey. It also includes information to help you evaluate the different long-term services and support options. The medication management subsection provides resources to assist with organizing, administering, and tracking medications. It also includes medications-specific videos from the Caregiver Video Library.
Under the Printable Resources page, we have created and consolidated a number of tools, worksheets, and checklists that are designed to assist caregivers with specific tasks and logistics that they may need to handle at some point in their journey. Use the budget worksheet to prepare a balanced monthly budget to track income, expenses, and set money aside for savings. The Care Needs worksheet can help you determine what types of assistance the person you're caring for needs. The Caregiver Coordination worksheet will help you document and divide up the caregiving duties among family, friends, or hired support workers. The Caregiver Decisions worksheet will assist you in working through caregiving challenges to identify solutions and make informed decisions. The Emergency Preparedness worksheet will help you explore the key steps and needs to prepare for all kinds of emergencies.
Use the End-of-Life Planning worksheet to reflect on the emotional, spiritual, medical, and practical decisions that the person you are caring for may face at the end of their life. The Funeral Planning worksheet will help you plan for arrangements and considerations before the person you are caring for has died. The Home Health Hiring worksheet will help you ask the right questions to collect information about each home health service you're considering. The Home Safety worksheet will help you identify potential hazards in the home of the person you are caring for. Use it to identify any changes or repairs needed to help keep them safe. The Older Adult Housing Needs worksheet will help you evaluate the best housing options based on their individual needs, preferences, and resources. The Important Documents worksheet will help you stay organized and keep track of important and sensitive information. The In-Person Visit worksheet will help you document changes in health and well-being during in-person visits. In general, it helps you look for signs of trouble with or changes in thinking skills, vision, and physical activity. The Long-Term Care worksheet helps caregivers facilitate open conversations and thoughtful decision-making as you and the person you care for check long-term care options. Use the Managing Medications worksheet to record medication schedules and dosages. Use the Medical Appointment worksheet to stay organized for doctor appointments. Additionally, this page has all 10 resource guides for easy access.
The Caregiver Resources page also includes the Pennsylvania Library Directory. Libraries are a great resource for caregivers. Find public, academic, and special libraries, library organizations, and more. Caregivers can find libraries close to them to get printed materials or assistance in navigating the CareKit website. Click here to access the directory. The final section of the PA CareKit is the Self-Care Resources section. This section is meant to help caregivers answer the question, how can I better take care of myself?
The Physical and Mental Self-Care page is meant to help illustrate the different ways that the demands of caregiving can be exhausting, physically and mentally. It offers information to help you take care of your health and well-being. The Emotional Self-Care page helps caregivers understand hard feelings, recognize their triggers and impact, and find ways to cope and help maintain their health and well-being. It also provides information on specific types of emotions and resources to explore them further. The Respite Care page is meant to help caregivers understand what respite care is, what options are available, and how to access them.
Caregiver Support Groups. This page is meant to raise awareness of support groups, illustrate their purpose and value, and help caregivers find the support group that's right for them. Many caregivers are also workers. This page is designed to help them understand benefits that may support them and their rights as employees. Thank you for your interest in learning more about the PA CareKit. For more information, contact the Pennsylvania Department of Aging at agingplan@pa.gov.